Ruth O'Neill and I, Attorney Ruth O'Neill, who worked for mocasa.org at the time, went over the medical records from University of Missouri, specifically the 4 or 5 days that I was on the MUPC, or Missouri Psychiatric Center, ward. She basically stated that I wasn't going to get care because I was blowing whistles on their fraudulent billing and their criminal malpractices of refusing me proper care, refusing to ask diagnostic questions, refused to make proper referrals, and falsifying their medical records to hide, ultimately, the discrimination in the provision of healthcare services. I'm autistic. Right now, I can maintain, what I'm doing now is masking or mimicking neurotypical behavior for the purposes of communication. I'm what's called a prodigious savant. I'm autistic. I have the savant memory, that huge mega eidetic memory. I think in moving pictures I can pull up, about what I would call equivalent to about 4 million lines of code, and I have to sort through that and interpret that into a linear line of communication to let you know what's going on with me, which is usually a whole lot, because I take in everything. I'm also what we now know to be called an empathic savant, meaning I pick up on everything that's going on with another person and everything that's going on around me, and I internalize that so much that it's hard for me to differentiate the information of what's going on with someone else, their emotions, their attitudes, their behavior. And I can, what you'd see me do is, if I'm around a doctor, I'll mimic their affect. If I'm around, say, more relaxed, like people on the street, homeless people, I'll start mimicking their affect. It's a way of communication. It's a masking and coping skill that is pretty typical in persons with autism, especially women, because we gravitate to other people, and we use that to learn how to communicate. So I recorded myself telling every single one of these providers that I mentioned previously that I was autistic, and they would get right up in my face and watch me flinch, and then they would see that affect. When normally someone's looking me in the face, I'm doing this, and I may be rocking, and I may be wiggling my fingers and self-stimming. Right now I'm in my own home. I'm in my art studio. There's nobody firing questions at me. So I have all this bleeding, and it's not getting any better. I'm looking pretty rough because of the pain. It's pretty unmistakable in my face. Right now I'm medicated. I took a half of a pain pill that was prescribed, about a week ago or so, when I had explosive bleeding, and went by ambulance to Boone Hospital Center, where Dr. Scott wasn't very happy to see me and threw up in my face that I wrote him up to the Missouri Board of Healing Arts. But for the purposes of continuing the ongoing, giving a linear line of history, after this wound got extremely infected and I had red streaks running up my leg, Attorney Ruth O'Neill escorted me. She said, "Which hospital do you want to go to? I'm going to make sure you get a referral to Family Health Center." Why they're not doing this? They know they're supposed to be doing this. Is what she basically said. And she also told me that one of the other staff people there, who didn't like my affect for whatever reason, because of my Asperger's, my autism affect, told the medical community that I was doing things that I wasn't doing, and perpetuated false information to make sure I wouldn't get care. Well, Ruth realized this to be wrong and that I really needed care, and she made sure I got a referral to Family Health Center. She took me into Boone Hospital Center's ER, I believe on August 30th, or July 30th of 2014. I believe it was a Dr. Weber or Dr. Murphy said you have the beginning of a cellulosis. I had just been discharged as an inpatient at University of Missouri hospital. They had written that there was no problems. I didn't need any other care. It was infected before I ever left there. They just wanted me out of town because for whatever reason I was homeless. Screw it. Never mind the fact that I was born here, raised here. I came here to write my books. They did not care about my interests and making sure I got proper care. And I wasn't well enough to leave anyway. I was way too crippled from the pain. So we went into Boone's ER, and that doctor said you have the beginning of a cellulosis. She referred me to the wound care clinic, and she gave me an emergency referral to Family Health Center. I show up for I go and I get my wound care with Dr. Jameson over at their wound care clinic at Boone. I end up, because of Rachel's being uncomfortable with my autism, whatever it was, at Lois Bryant House, I'm sleeping on the streets. And I'm okay with that. Because there's a missing kid, and I knew something wasn't right. I saw him with people that didn't look right, and it turns out he was a missing kid who had ran away, and they were feeding him drugs and trafficking the kid. I helped get him home. I believe I did. Nobody's ever going to put that on a record, but I still have all the emails to a police officer. And she pulled me into the station and questioned me about it, and then sent me an email and said that we got him home. And I had worked with Ruth on that too. I told Ruth about it. I'm not going to go into too much of that. But I go into this exam with this resident doctor, Megan Cates, at Family Health Center. I told her where my pain was, how it shot down my legs, that I felt it in my back, which was actually my rear end, way down low under the butt. And that I was bleeding constantly. Nothing stopped the bleeding. That they had ran fluids. They did an ultrasound at Boone. But nobody told me what was on it. He said it had a couple eggs stuck, but I really needed to see a GYN to get this bleeding dealt with. And that he told me to go back to Arizona for care. That's not what he documented. He documented something different. She says, what do you need me to deal with today for the most part? And I said, if you're not going to send me to a GYN or send for Boone's records, which she actually said, she had me sign releases, and I recorded the entire exam. She had me sign releases for Boone Hospital Center, which Boone said she didn't even need. Rainbow Pediatrics and their University of Missouri affiliate, so said she was sending for University of Missouri's records. She said, if you don't like University of Missouri, I'm a university doctor. You're not gonna want me as your doctor. She was very rude. She refused to deal with the bleeding, to make a proper referral to a GYN, wrote for a narcotic pain reliever, violated policy, wrote for a narcotic because the pain was just that bad. I said, I've got to be able to function. I can barely, walk to be able to shower. I'm not sleeping. I've got this sharp shooting pain in my privates. And she didn't lift up my shirt and say, the first thing, with all the bleeding and the pattern of the pain, she should have lifted up my shirt and said, you've got swelling back there. That's uterine swelling. Let me send for Boone's records. She writes for the medication. She says, come back in 2 weeks and then we'll deal with the rest of it. I says, okay. A lady named Nanette Ward, who I was working with, was the Central Missouri Stop Human Trafficking Coalition. She says, so what did they tell you? I said, she basically gave me pain medicine and isn't dealing with the bleeding. They're not dealing with anything that I need, I really want, because Nanette and her other advocates with the Central Missouri Stop Human Trafficking Coalition were constantly bringing me pads. She said, that's very irresponsible. I want to go and be with you on your next exam there. So I'll tell you about that. I'm going to upload this video and then tell you what happened.